Looking for affordable and engaging coding education? Here's just a snippet from one of our recent webinars. Visit thehaugengroup.com to shop Haugen Academy and learn more about what makes Haugen different.
The sensitive information, I think, is really key for us to talk about it. And I know, Jen, you're particularly passionate about this. So why don't you kick it off and then we'll have the conversation.
Thanks, Mary Beth, if you don't mind. I do. I always, when I start to hear about behavioral health documentation and folks start to use that terminology, sensitive information, I start to think about how we can sometimes misinterpret, things like what is a psychotherapy note, and we can really start to build barriers in that exchange of behavioral health information that is not psychotherapy notes, right? That really needs to be shared for that continuity of care. So I like to just put that out there when you are making these determinations around sensitive information. If you do have psychotherapy notes in your system, that's one thing, because we know they are an exception, but really think of it as kind of staying in your lane with that and really limiting that to true psychotherapy notes, because I've seen it be sort of, again, overinterpreted. And now we have, information about the treatment and the modality of treatment for patients, the medications prescribed, the diagnosis of the patient, and we have that hesitancy to release that to the patient's primary care provider. And that is where, it's just really important to not treat all behavioral health as kind of a hands-off and really understanding how to make those decisions.
Absolutely. Well, it's changed over the years, and I think, providers are really seeing initially, way back prior to the Privacy Act, we almost isolated it a little too much. And so in order to really treat the whole patient, we need to really truly have that balance for sure.